What's going on, you guys? It's your boy, Dr. Tochi here. I am currently here on a new journey. I know it's been quite some time since we last spoken. Last I think we saw each other, I was still in my chief year, which I finished about a month ago. And now I have moved on to a new position for which I'm starting a new fellowship position in hospice and palliative care. Now, I don't believe I shared this with you guys in the past videos of what I was actually planning to do with my medical career. Initially, when I first got into residency, I thought I was going to be doing internal medicine, which is primarily based with adult medicine, heart failure, cancer, COPD, diabetes, the whole nine. And during my second year of residency, I was actually in the ICU. And during that time, I actually decided to switch my career goals in medicine, decided to go towards hospice and palliative medicine, specifically because of my experience in the ICU with a lot of family meetings and with the palliative care team. Now, if you guys aren't aware of what palliative care and hospice medicine is, palliative care is a field of medicine that is made up with specialized groups of, physicians, nurses, social workers, chaplains, music therapists. It's a whole team of people that is aimed to help people that are dealing with very serious illnesses. And oftentimes, it's people with, a lot of cancers, people that have, very severe illnesses that take away from their quality of life. And the point of palliative care is to actually be a team to help those people in that transition when they are nearing the end of life. And it's not just hospice care, which is a lot of what people confuse palliative care for. Hospice care is more so directed towards people that are in the last 6 months of life, but palliative care can be used at any time in their medical illnesses. So during my time in the ICU in my second year of residency, in those meetings, I felt that I was actually able to see the patient more than a patient, but actually a human being with a lot of, background and cultures and, family makeup and social dynamics. And oftentimes when you're in medicine, especially during residency, because of how long it is, how stressful it is, and how many patients you're seeing, oftentimes, and it's not, a fault of the doctors, but because you're seeing so many patients on high volume, you just see them oftentimes as a diagnosis that you're trying to fix. And that's something that I noticed during my time in residency that I really wanted to avoid is getting to the point where, I was just seeing my patients as, this is a heart failure patient, or this is a COPD patient, or this is a diabetes patient, but more so, this is like a middle-aged gentleman of Taiwanese descent who has this specific cultural background that has this sort of like religious beliefs that forms the way that they see their life and actually contributes to why they make certain medical decisions. So that just makes it feel a lot more fulfilling because I'm able to have a discussion with the patient and not just go in there talking about their heart failure all the time or their diabetes all the time, but actually meeting them and seeing, where are you from? What is your family makeup? What religious practices do you have? What are your values and wishes that you want for your life? And that just made the whole experience of medicine a lot more fulfilling for me and is actually the reason why I went into hospice and palliative care. Now, this program is about a year and it's a pretty quick program. Other programs are, 3 years, 2 years, but because it's a year, I'm going to be, learning a lot of these things in high volume in a short amount of time. And in other sorts of fields, you have more time to, do things. But in this field, even though it's a short field, I am going to be doing a lot. So at my current fellowship program, I'm going to be rotating between, I think, 4 to 5 different sites. One of which is a hospital care. Another one is another hospital care. Another one's going to be at a VA. Another one's going to be at a hospice agency. And then another one's going to be in a inpatient hospice unit. So that is going to be what I'm going to be doing for the next year or so. I actually got this book to start reading. This is Evidence-Based Palliative Care. This is like a highly recommended book from my previous fellows that I spoke to about. So far I've read about 5 chapters and some of the stuff I've seen, but it's actually giving me a lot more detail and a lot more expertise that I've actually wanted to learn in the past, specifically around pain management. And, in these last couple of days of my actual fellowship, I have my very first day this last Friday, but this is actually going to be my first full week into this fellowship. And I'm going to be at a VA tomorrow I'm going to be doing both inpatient and outpatient clinic. And then for the rest of the week is just all inpatient consults. My first day that I actually had in the VA was quite interesting. I think VAs across the country use the same EMR, which is the electronic medical record, which is CPRS, which looks like an archaic EMR, which I'm not much of a fan of, but it's not as bad as I thought it was going to be. I'm used to using Epic, which I used during residency and during my medical school years. But, Epic I'll be using at the other hospital sites. So I'll be at this rotation for about, let's see, a month at a time. It looks like we usually do our rotations at this fellowship program for a month at a time. In my residency, it's a little bit different where you'll be on a service for either 1 to 2 weeks. But this one, it gives me a little bit more continuity and be in the same area. So I don't like stay on a rotation and then switch on a whole nother one and then have to learn a whole new system. So I'm pretty excited for what's to come. After this rotation, I'll be at the main hospital campus and then I'll go onto vacation for a week. And then I'll be bouncing back between like different, hospital institutions at different sites to kind of practice palliative care in different patient populations and learn along the way. And, my class is a lot smaller than my residency. My residency class was about 13 to 14 people and then 70 in its entirety. But for my fellowship class, there's just 3 of us. So that keeps us a little bit closer to each other. We can kind of bounce ideas off of each other and, share with each other what we're learning. So I'm pretty excited for my fellowship year. I'm looking forward to seeing what I actually do and what I go into in the future with palliative care. Right now, I'm thinking more on an outpatient basis, and, outpatient internal medicine is not really that fulfilling for me because you see so many patients in a short amount of period of time. But in this program that I actually, shadowed with before starting my fellowship, I was able to kind of view outpatient palliative care, their clinics, to see how different it was from internal medicine. And it was very different. Instead of seeing like 8 patients or 9 or 10 patients in a half day, I would see like maybe 7 to 8 in a full day. And as opposed to like 30 minutes, which really is like 10 to 15 minutes of seeing the patient, you have like half an hour, or no, you have 60 minutes to 90 minutes for each patient visit, which is a lot more fulfilling because you don't feel as rushed and you're able to delve into their life, learn them as a person, build a patient rapport and a relationship with them, and then actually have the time to make medical decisions with them where they feel like they can address everything and not feel rushed and pushed out to be seeing the new patient. So I'm really excited to see what that has in store for me. Tomorrow is my first day of the half day clinic. It's at the VA, which is not really the patient population or clinic setting that I want to be working in, but we'll get to see it nonetheless. I want to see and get as much experience that I can in these clinics. So I hope you guys enjoy these videos. I'm going to be making these weekly videos or bi-weekly videos, giving you guys my experience in this fellowship for those of you guys that are interested in hospice and palliative care. So if you guys want to stay with the journey, continue to subscribe and follow down below and drop any questions that you guys have down below about hospice and palliative care, because I'm going to be learning along with you guys. It's a year and I hope to be, a specialized doctor in this field to help not only my patients, but you guys learn, especially if you guys want to go into medicine and go into this field as well. So I hope you guys enjoyed this video. Thanks for joining for my update video, and I'll see you guys in the next one. Peace.